First of all, welcome for this Lunch and Learn. We're really excited to bring this topic to the team. My name is Denise Fessler and I'm a SCORE volunteer, and Kathy is our lead for education, and she's going to be driving us today. And the topic is We've Got You Covered, Sustaining Safe Small Business Operations. We're excited to have the expert panelists here with us today. We have Robert Teke Drummond, who is the Executive Director of Corporate Partnerships for Penn Medicine, Lancaster General Health, and the Penn Medicine HealthWorks. He's been presenting on safety issues in the past with us, and we're happy to have him back. Monica Rakoczy, who is an OSHA training specialist and has her business EnterTRAINING solutions. Excited to have her here as well because she is a SCORE client and a 2019 SCORE SBAL winner. Carl Shaak, who is an HVAC specialist and a manager for their sales and marketing for Berkshire Mechanical, which is a subsidiary of UGI. And last but not least, Laurie Holmes, who is a health, wellness, and safety specialist for Americhem International. She's also given some presentations with us in the past, and I'm really happy to have her here back today. Our next slide, yes. So why are we bringing this group together today? It's really important for us to operate safely. Really, businesses depend on it today more than ever. And it's critical for the businesses overall to manage because of the fact that we have competing priorities. We have rapidly changing conditions, and it really requires a focus on safety. And we're going to talk today about how we can really help businesses focus specifically in these areas. They're being bombarded right now with lots of information. The other thing is we've learned some things along the way as we've been giving these presentations on safety. It really was interesting as we kind of reflected on what we were learning, and that there were also some basic tenets that we need to make sure we're covered in safety that this COVID preparedness had actually brought to light. And so we wanted to talk about that today, and wanted to make sure we had things covered. So our agenda today is really on tips on maintaining safe operations. We'll talk about those. We'll have presentations on workplace safety and wellness, OSHA, ventilation systems, cleaning and disinfection, and then end with some questions. And we'll have some facilitated questions and obviously open it up to ask specific questions for the team. Just a little note, this training presentation is meant for instructive purposes only. It does not constitute legal advice and does not provide assurance of compliance with many facets and of applicable law. So let's get started. Some tips on maintaining operations. It's really important right now to follow these federal, state, and local regulations and guidelines. They're really changing rapidly. And I know it can be somewhat frustrating at times to see this change, but it really is based on the fact of the length of time that we're in this pandemic. There's been some excellent research coming out of Korea, for example, as a result of their contact tracing efforts. And we're understanding more about how the disease is spread, which is changing guidelines. It's important then for us to make sure that businesses are tapping into specific sites and also specifically on their social media so they get that information quickly. The other thing is really maintaining a safety plan. You want to have a plan in place, and you want a plan that's actually going to be owned by someone. So you want to have somebody responsible in your business. It's required by the Department of Health to have a responsible person to coordinate, and you really have to demonstrate that you can minimize risk. Why is that important? It's important because you really want to make sure that you can educate your employees effectively with all these changes. And you want somebody who's going to be able to keep up to date with the information. Educating your employees and customers about your regulations is critical. And when we talk about educating employees, you want to really educate not just to what they're supposed to do, but why. So that when they see differences in the way businesses are complying or not complying with regulations, they can explain to their customers, you can explain to your employees why, what's the rationale for what we're doing, and go back to the sources of the information that you're gaining from the CDC and the DOH, et cetera. You want to reinforce this culture of caring. Making sure that you're keeping up to date means that you actually care about your employees, you care about your customer base. And last but not least, being prepared for this according-like process is very important. So as we're going through this process, initially, we were looking at developing pivot strategies, but the bottom line is you want to make sure you hold on to those, continue to nurture them, because you may need them again. So bottom line is, if you've developed some virtual capabilities, if you've developed some online capabilities, outside services, etc., you want to continue to develop them, because it's likely that you may have to go back to them in the event that the infection rates could potentially go up again in our community. Next slide. Our next presenter is Teke Drummond. He's going to talk about COVID community update and talk about the HealthWorks program that Penn's developed. Teke?
Thanks, Kath. Thanks, Denise. So we're, thanks for having me. I've spoken a lot over the last 3 months or so to update the businesses and the community on what's going on, and a lot has changed in those 3 months. With my colleagues on this presentation being a lot of subject matter experts, I'm going to try to handle kind of an overview of where we are today. And as you'll see, we're getting control of the infection, but it's still really active in the community. And so we want to make sure that when we as we continue to open up the community, we're doing so in a safe and responsible manner. So broadly stated, the Penn Medicine HealthWorks, so this is an extension of the Penn Medicine Lancaster General Health System. Our focus and my focus is to make sure that we provide a portfolio of services to benefit employers in our community. And that's what I've been doing over the last couple of years. So now is an essential time for us to make sure we're well connected with employers, and the SCORE group in particular being liaison to that group is really important that we keep you guys really well informed. So let's go to the next slide, Kath. So you have access, anybody has access to this on the Pennsylvania Department of Health website to be able to monitor the trending of the infection rate and death rate for the state and then each individual county. And when I've gone through the chambers and others to talk about their individual counties, they're all trending in a kind of a similar fashion. I'll focus primarily on Pennsylvania and Lancaster, but for those of you that are from the surrounding counties or want to look at that, you can get into the specifics of any county, any day, and understand where they are with their trends. So broadly stated, let's focus on going left to right here. If you start with the Pennsylvania cases by day, let's focus on those areas first. You can see how we had a rapid rise into April, which was really scary for all of us. And you're hearing about the surges that are going on in Florida, Texas, the Southwest. We were there. We were there back in April, and we were expecting that rise to exponentially increase, which would have been devastating for our county. But all of the kind of regulations that were instituted and the lockdown that was created by the governor and the Department of Health in Pennsylvania did flatten the curve, undoubtedly flatten the curve. And you can see on the left with the Pennsylvania, there was a dramatic, constant kind of decrease that happened through May. And you can see this rise that happened at the end of January into July, which coincides, I can't say causative, but certainly a correlation with the opening of businesses and services on top of just the natural community's way of getting out because of the summer and engaging more socially. So that did get a rise, and every county is a little bit different. So if you go to the east of us, those counties had a very prolonged surge opportunity that happened well into May, and they, including us as a part of the southeastern region for the governor's office, were a little bit late to open because the West was doing a little better. And then I'm sure you guys are focused on the news. You know that Allegheny County, for instance, saw a rapid rise recently. So all of those are contributing to that mini kind of climb that's happened in the latter part of June into July. The middle one in Lancaster, you can see that rapid rise, and then there is this kind of this step down flattening that's happened over the last 2 months. We didn't see this dramatic drop that happened, but we are seeing that true flattening of the curve. That's absolutely what happened. And we're seeing this slow progressive decrease in cases, but it's alive and well. What I want to do point out to you is the deaths, because a lot of people talk about the deaths. Well, the death rate is down. The death rate is down not because the infection is any less, but because we're managing it much, much better as providers. So early on, when you see a high death rate, we were doing a lot of ICU care, a lot of ventilators, a lot of intubation, and honestly, that ventilator gets you to a 50-50 survival rate. And we learned a lot about it. And now, primarily, the treatment is not putting them on the ventilators. They're doing a lot of prone kind of positioning on their bellies. We learned a lot with medications, and we're administering it much, much better. So the message here is the infection is very active. The death rate is down, but it doesn't mean the infection is any less. So then switch forward on the two graphs on the right-hand side, and this is where it really makes a lot of sense for you. So if you focus on the deaths, which I'm sure many of you have heard, it affects the older population much more significantly, and it does. So for those that are 60 and above, you have a much higher death rate than those that are under. But look at the distribution of the cases. The cases are much higher in those that are younger, the 20 to 50-year-olds. So the case is really spreading through the younger population. When it hits the older population, even though the infection rate is less, for those that it hits, it has a devastating effect, which is why we have to, it's a very unselfish kind of attitude that we're not doing this for ourselves. We're doing this to mitigate the control. And if we get that herd immunity where we're generally kind of, for instance, we're not allowing the disease to propagate itself because of the mask usage and some of the controls we have, we're in good shape. Go ahead to the next slide, Kath. 3 precautions, and I'm just setting the stage for my colleagues. So ultimately, it's 3 simple areas: prevention, exposure management, and then monitoring those return to work. So prevention is the key, and it's simple. We're not talking about major issues. You have to take medicine. You have to, kind of do some major sacrifices. It's hand washing, it's distances, it's masks. Pretty simple stuff. And through that, and what I tell employers, and hopefully you tell them too, is all the stuff that you're gonna hear from my colleagues is not gonna necessarily keep the infection out. It's gonna come into the workplace. And because of the prolonged incubation period, you're gonna have employees that are sick, that don't know it, that are in the workplace. So exposure is going to happen. So what I tell people is you just have to assume that everyone you know is sick and they just don't know it. And if you can act in that way from prevention, you're going to minimize the exposure rate. What you want to avoid is the exposure, because that has devastating effect economically. Devastating on them being on quarantine and then to possibly return to work. And I won't even get into the staggered issue of having family members exposed, which is where it really sheds itself, that you're really prolonging your quarantine status if you have a family member and you're employed. You could be out of work for a month and a half if you have a family member or a couple family members that get it. So my colleagues will talk more about that in a minute. Let's go to the next slide, Kath. This goes through the testing. I'm going to go through this real quick because of the time. So ultimately, the big messaging I want to provide here is Lancaster General Health is not providing asymptomatic testing. The only time we're testing people is when they have symptoms. And the reason for that is it's not necessary for people who don't have symptoms. We need to be mindful of the testing availability. The more we test, the more delays for those that we have that have it. So we can make sure that when we test people, it's necessary so we can turn around tests in 2 days and not 2 weeks. That's what you need. So the more we can do that, the better. We do open it up for people that have pre-travel issues to those states that aren't admitting people unless they have tests, so we provide for that. And then we have for the post-travel returns, when you come out of a state that requires you to quarantine yourself, we aren't doing the testing for that. The state is advising, we're complying with that is a self-quarantine measure. It's a sacrifice and a concern, but people should know that when they go into the South Carolinas, then into the Floridas, into the Arizonas, you're going to have to quarantine when you get back. There's not a testing protocol that you can go through. The latter part of this, I'm sure we'll make this available to you guys, is where to get your testing done. And if you're symptomatic, all the primary care offices are offering, all family docs are offering it, the urgent cares are offering it. I'm sure that our colleagues at WellSpan and UPMC are offering the same thing. And then we have been doing testing since we resumed surgeries for all patients to make sure our facilities are infection-free. Let's go next slide, and then I'll wrap it up here. This is just a real quick introduction, and some of you have seen this before. Back in end of March, we established a program to keep employers informed on a weekly basis what's going on. So we do that through a newsletter. And then in May, we established a Kicking COVID Together, where we take our occupational medicine and our employee wellness team to come on site to an employer and provide training, assessment, and determine your vulnerabilities for the COVID. Many cases, people are pretty well prepared. They just need assurances of what they're needing to do. And the second part is just really kind of mitigating the irrational anxiety that staff have. And if we can do that, you'll be prepared to engage your staff and you'll be prepared to engage customers. That's it in a nutshell. I'll pass it over to Monica now. Next slide.
Hi, everybody. My name is Monica Rakoczy. I am the owner of EnterTRAINING Solutions. I'm a safety compliance company that helps with OSHA compliance. And I'm just going to give you kind of a higher reaching overview of who OSHA applies to, as well as what some of the requirements are regarding all of this. Next slide, please. So there seems to be some question as to who's actually regulated under OSHA, Occupational Safety and Health Act, especially with small businesses. So the best way to go through it is just answer a couple questions. Number one, are you a private sector business? OSHA only covers private sector business. So if you are a Lancaster County employee, if you're a public school teacher, etc., you're not covered under OSHA regs. The next one is if you are self-employed. OSHA does not cover somebody who is self-employed. However, the moment you hire an employee, you are covered under OSHA regs. Lancaster is a big agriculture area, so as far as farming goes, OSHA does cover farming. The only exemption would be is if the only people who are working on the farm are direct relatives of yours. If you have anybody who is an employee on your farm that is not a direct family member, you are covered under OSHA regs. And last but not least, if you're regulated by another agency such as MSHA or the Coast Guard, MSHA is Mine Safety and Health. So these would be our local quarries, etc., that would not be covered under OSHA regulations. Outside of that, if you are private sector, if you have any employees that are non-family members as a farming agency, you are going to be covered under OSHA regs. And it's super important for our small businesses to understand this. Because once you're under OSHA regulations, you have a lot of laws that you have to abide by, and the fine structure for not abiding by them is pretty stealthy. They're looking at up to $132,000 for serious violations per instance at this point. So it can get very expensive to not follow OSHA regs. So let's look at what the basic requirements are for being under OSHA regulations. The first one would be what we call the general duty clause, which is providing a workplace free from serious recognized hazards and comply with OSHA standards, rules, regs issued under the Occupational Safety and Health Act. That can be a little daunting if you don't know what all the rules and regs are, and there are a lot of them. So what you want to do is you want to examine your workplace conditions to make sure they conform to the applicable OSHA standards. If you don't know the OSHA standards, that can be a little tough. If you go on to OSHA.gov, that's the website, free website run by OSHA. They give you a lot of tools to help you manage all of this. One of them is actually a compliance assistance quick start for your workplace conditions, and it breaks it into 3 different industries. So the first one would be general industry. What they do is they help you walk through what the typical standards are that apply to your industry and help you figure out what training requirements, et cetera, you need. General industry, that's my retail stores, that's my restaurants, that's my factories. There's another quick start for medicine, so that's going to be my dental offices, my medical offices, and then there's a third for construction. So another big thing that is under the basic requirements is making sure that we have what we call a HazCom program. HazCom is anybody who's dealing with hazardous chemicals. We need to make sure we have hazard communication regarding those chemicals. So that's having a written safety plan in place, as well as training for our employees and safety data sheets available. A lot of people think, well, I don't work with hazardous chemicals, but you got to understand a lot of these cleaning agents that we're bringing in, they have a lot of potential problems that can go along with them. So especially with COVID coming in, we need to understand our HazCom requirements. The next one is posting at a prominent location within the workplace, the OSHA poster. There's a free poster on OSHA's website that you must post for your employees to understand what their what your requirements as an employer are, as well as what their rights are. When we say a prominent location, that would be maybe in an employee break room or maybe by a time clock. The next one that you would have as an employer would be providing most PPE at no cost to your employees. PPE is personal protective equipment. This includes things like gloves, masks, safety glasses, etc. So if you're requiring your workers to wear this for work, we need to make sure that we're providing it to them for no cost. My next one is following reporting and record keeping requirements. So reporting requirements apply to everybody. If there is a workplace fatality and or a hospitalization, amputation, loss of an eye, we need to report that to our local area office. For us, our local office is out of Harrisburg. We have certain timing requirements on that. And then record keeping, if you have more than 10 employees with certain exemptions, like some retail locations, we need to keep track of injury and illnesses at our location and make sure we report them yearly to OSHA. This can all be found on osha.gov. All right, next slide, please. So what's all this mean with COVID-19? Just like having a HazCom program, we want to have a pandemic program. A pandemic program is going to be how we handle illnesses that could potentially affect our workplace. And we really want to make sure we stick to this and be universal with it. So what I mean by that is if we're going to require mask usage at work, make sure we're applying that to all of our employees and all day long. Don't start to let things slide here and there, because that's where we start to get into some tricky areas. Now, with that being said, we do want to be a little flexible in that plan. We've seen a lot of changes with COVID and the guidance that's come out there with it. So we want to make sure that we understand that while this plan is in place, we're going to have to adapt it as new information comes up. The next one that we want to do is if you go onto OSHA's website, you can follow the guidance that they put out there. They have a whole COVID-19 website for us to help us. That includes assessing the hazards to which our workers may be exposed, like customer interaction, employee interaction, evaluating the risk of exposure, like how much interaction they may have, and then how do we protect our workers in the workplace. So we're going to follow the hierarchy of controls, the best to least best way to protect our employees. One of them would be an administrative control. That would be social distancing, making sure that we're trying to keep as much distance between employees and customers as possible. The next one would be engineering controls. That's physical barriers that we put up. You see these plexiglass things all over the place. They're a great way to prevent exposure. And the last and least effective way is going to be our PPE, but still super important. So we want to make sure that our employees have the right PPE. We understand where the modes of entry are to the body. The next one is, even though we talk about PPE and how much we need to make sure we're using it, I really want you guys to be careful on what we're suggesting with PPE. Specifically our mask requirements. You've heard the term N95 tossed around 1,000 times. If you are going to require N95 usage, if that's the mask you're going to ask your employees to wear, so dental offices, doctor offices, I'm talking to you guys, if that's what you're going to require you to wear, then you're going to need to make sure that your employees go through pre-wearing medical evaluations that must be evaluated by licensed healthcare practitioners, and they got to be fit tested for these respirators. You'd be amazed at how many of these N95s do not universally fit people. So they need to go through either a qualitative or quantitative test to make sure that this is the right respirator for them. So if you have aerosolizing procedures, please make sure you're doing that with your employees. The next one is making sure you teach your employees how to properly wear PPE. Gloves are great, But only wearing them is half the battle. Removing them afterwards is a whole new worry. So you need to make sure that you train your employees on how to properly remove and dispose of their gloves. We call that donning and doffing. That's just a safety dork term for how to put them on and how to take them off. All right, and the last one that I have is making sure we keep our safety data sheets for these cleaning supplies. So that goes back to the HAZCOM program that I talked about before. These cleaning supplies are awesome. They kill COVID-19, super great. However, we need to be careful with all the other hazards that they're bringing into the workplace, especially mixing chemicals. So not only trying to mix them when cleaning, residual leftover, or even storage can be hazardous. If you want a terrible example of that, look at what happened at Buffalo Wild Wings in Massachusetts in November of last year. An employee mixed 2 different chemicals into a bucket. It caused a hazardous gas to be created. It ended up killing the manager who worked there and sent 10 other people to the hospital, just cleaning a restaurant. We have to understand how important these chemicals are and training our employees on the dangers behind them. So that's an overarching view of the OSHA rules and the guidance that affects us with all of this COVID-19 going on. There are plenty of places that you can get more information. You can get them from safety compliance assistant specialists like Dale Glacken out of our local OSHA office. You can talk to any of the safety consulting companies in the area. And you can go on to OSHA.gov. OSHA.gov is the free website to use. There's a ton of information out there that's available, plenty of posters, everything that you can print off for free. All right, with that, that completes my section. So I'm gonna kick it over to Carl Shaak, our HVAC specialist for indoor air quality.
Carl, you might have to unmute.
There. Everybody hear me now? I broke the ice. Current research shows that the virus can live in the air for 3 hours. So that makes fresh air to a building now or even to a home more important than it ever was. And there's a lot of things you can do to increase that rate of fresh air to your home or to your business. Depending on what business you have, you're already supposed to legally have fresh air through like IMC code. So for like a conference room, you'd be looking at 5 CFMs per person, which the equivalent of that for people, you know, you can bring in that fresh air is to keep everything moving. And the more you bring into the building, the more it's going to push that virus around and get it out of your building. And you're filtering out that air. So you want to make sure any of your vents are unblocked, make sure they're open, that the air is free flowing. Having your filters changed on a regular basis is extremely important to making sure that you have that proper airflow. Any debris you see, a lot of times what you'll see in buildings, like the air that goes back to the system, where the grill is in the ceiling or in the wall, it's going to get built up with a lot of dirt. And then that can also reduce. So it's not necessarily the filter, but that's like a visual thing you can see. Restaurants are known for that. Like if you go into a restaurant and you look up at the ductwork, sometimes you can just see a lot of dirt build up on it. And that would tell me that you're not moving the proper amount of air through your building even before all this. The regular PM system, making sure that your filters or your coils are cleaned and the filters are changed. The big thing with fresh air is to make sure that your fan switch would be set to on. So like in a building, if you're in occupied mode, you want to get rid of that demand occupied mode, which is bringing in, they used to go off CO2. So if the CO2 wasn't very high in the space, your fan wouldn't probably be running. So now with the COVID-19, they kind of are saying just avoid that and let the fan run all the time. By the fan circulating all the time, you're constantly moving the air throughout the space and you're introducing new air into your building. Having the ductwork clean is very important, and this ties into the grills. So with the controls, like if you're not sure on the thermostat, that would be something you could reach out to like your current vendor of who you're using and ask them, you know, how to make your fan run all the time so you're actually circulating air constantly. A lot of offices, people close their door. So if the door is closed, you might not be moving air in that office, in that building, in that room. So that's a huge thing to make sure that you're doing. To the next slide with air filters. The MERV rating, they're saying, you know, it's being tested that they're saying anything under a MERV rating of 8 isn't really doing too much to help with the virus. The higher the MERV rating, you can go between an 8 to a 13. On that MERV rating 13, they are saying that it does catch droplets and it keeps it out of the airstream. With going to that MERV 13, it's kind of a little bit of a double-edged sword because you're reducing the airflow that you're getting to the space. So if you want to switch your filters out, having your contractor definitely make sure that, you know, you're still getting the proper airflow. There's adjustments they can make to the system, to the fan, to speed up the airflow and overcompensate, you know, the heavier filter. The MERV 13 filter is a very restrictive filter. So you're also going to catch a lot more pollen and dust. So if in the workplace, it's definitely going to keep your workplace a lot cleaner, and it's helping with the virus. With the next slide that we go to, you know, the UV lights is still something that's kind of a little bit of an unknown. There's a lot of testing going on. There's a lot of companies looking to be the first person to come out and say that they have, you know, the fix to get rid of the COVID-19 and keep it out of your airstream. The UVs have been tested to kill viruses. So they are advertised as a broad term that they'll kill viruses. It's not specified though to like what viruses they kill. They also kill a lot of different things. They kill bacteria and mold, and it can prevent mold growth. So the UV light is definitely something that is worth looking into, but just being leery on what they're saying that it can take care of and what it can do for you and your air quality. The commercial industry with airflow and air quality has been so far behind the residential market. The residential market had air scrubbers. They had, you know, you can mount like a fan mounted HEPA assist on it. You can do a lot of different things, but the commercial industry has always been kind of like just replace the filters and call it good. And now this has really changed everything that we're doing. And people are starting to look at, you know, the UVs as a serious thing in the commercial industry. We're getting a lot of calls for it now. UV lights are, you know, they're back ordered. They're hard to get. They're a month to 2 month lead time. And the same with the filters. Everybody jumping from like the MERV 10 was like your usual average filter you use. So when you jump to that MERV 13, it's making a very big backlog and not being able to have the supply to get it. I know we're having struggles where it takes us almost a month to get some certain filters in on that MERV 13 level. So it's definitely a different day for air quality. It's something that was always on the back burner. So it's interesting what it's changed. Your HVAC contractor can also help you out, making sure that you have that yearly maintenance done on your equipment, just to make sure you are moving the proper airflow is huge. And it's also going to get the most life out of your system, you know, because if you're upgrading that filter, it can put a lot of wear on the system if it's not ready to have like that more restrictive filter. So you can determine how much fresh air your building's getting. Like we can do a lot with that. On air tests, your HVAC contractor can actually tell you how many CFMs are being introduced. And like I said, it can vary from, you know, classrooms to conference rooms to locker rooms. So with that, I'd like to turn it over to Laurie.
Great. Hello, everybody. Again, thank you guys for having me join your panel today. My name is Laurie Holmes. I'm with a distributor out of Middletown, Pennsylvania called Americhem, and I'm their health, wellness, and safety specialist. So much of what Monica says, I feel like we're twins separated from birth sometimes, with the stuff that she talks about, because I do have a clinical background. I worked for Cardinal Health for 6.5 years, managing the laparoscopic instruments at Hershey Med. So and then I also was a perioperative aide, and I would get patients who were possible TB patients, and so I had to be fit tested. So I can totally agree with everything she says. Go ahead, next slide. Okay, so just as the OSHA site provides posters, so does CDC. The poster that you see to the left says stop the spread of germs. And each of those 6 points are essentially the same 6 points I would have talked about 2 years ago, 5 years ago. Nothing has really changed. What's happening now, though, because of this COVID situation, everybody's kind of sitting up and paying a little bit more attention. So if you look at the chart to the right, that would be the chain of infection. And essentially what we're doing when we're in the cleaning industry is we're breaking that chain of infection. That was, when I was in sterile processing, this was drilled into our heads pretty frequently. The first ingredient you need, of course, is the pathogen. You'll see that's at the top. Next, you have the reservoir, that would be where it would live, particularly our hands. We've talked about proper hand washing. Next is the portal of exit. How does it come out of the body? Are we coughing, sneezing, bleeding? So then the next part would be the means of transmission or the mode of transmission. How does it travel then from myself, if I sneeze, to that next person? And much like the portal of exit, how it comes out, it can also go in. So again, the jury's out as far as exactly how COVID is transmitted precisely, but if somebody sneezes and you do not have your airway covered, which would be your nose and your mouth, you could potentially inhale that virus. There's plenty of videos out there, by the way, that if you Google how does a virus work, which are very intriguing, I think it'll give you a better sense of how they infect the body. Next would be the susceptible host, and that could be talking, which Teke had made mention of before, the susceptibility based on age. It seems to affect the older population more than it would younger, so to speak, but also can speak to nutrition. You could be susceptible with poor nutrition, low immune system, etc. So we have these 6 steps. We're always going to have the pathogen, the viruses, the bacteria. But one thing that is constant that we can have control over is how we clean the reservoir, which again, speaking to proper hand washing, wiping off desk surfaces, cell phones. You don't even know what's on a cell phone, right? So making sure that if you don't have a tissue available, that you cough into your elbow. Okay, we call that dabbing. You cough into the old elbow. So measures like that. Go ahead, on to the next one. So one of the things that I love to do is called ATP testing. This is a great quantitative way of being able to look at a surface. I can look at a surface with the naked eye, but I can't truly tell if there's any microbials or viruses left behind. With ATP testing, every cell emits energy, and this particular testing will pick up on that energy. So if you go ahead and click on the next one. So I conducted a test, believe it or not, in my own kitchen on a very common area that we can all probably relate to. I'll show you that in just a second. I initially took the first test at 1:16 p.m. I swabbed it. It registered it at 6,713. By all means, that item should walk on its own. I then applied a proper, I sanitized it because it's something that would be possibly introduced through the oral route of I'll get to that next. And then I let it sit for the proper dwell time. Dwell time is extremely key. So for example, if you would take a can of Lysol, which everybody's talking about, and you would read the back of that can, you would surely see then that depending on the item that you want to kill, you're going to have different dwell times or kill times. So it could range anywhere from 30 seconds, 3 minutes. It could be up to 10 minutes. That's a lot of Lysol that you would be spraying in order to kill X, Y, and Z, correct? So it's actually often better to use a chemical that you can dilute. You'll get your money's worth out of it, etc. So are you guys curious to see what I cleaned? Go ahead, next slide. Oh, there it is, the good old dog bowl. That's right. You ever go to pick up your cat bowl, your dog bowl, whatever type of pet you might have, and it feels slimy? That's an actual biofilm. So that just means the bacteria, moisture has had time to create this matrix of growth inside your dog bowl. So it takes both the proper disinfectant or sanitizer in this case, the dwell time, and then that physical removal or cleaning of that in order to remove that soil. But it's pretty impressive that I was able to take it from 6,000 to 0. So this is why I love ATP testing, because it's very eye-opening. Go ahead, next one. So let's talk about some different ways that we can break the chain and maintain consistency. As we've mentioned before, it's going to take a mindset shift. Imagine you're the customer, perception is reality. So when you're entering your space, kind of look at it from the customer's point of view. Create a cleaning, sanitizing, disinfection program and adhere to the manufacturer's instructions. So just this morning, I did a preventative maintenance process in my dishwasher, and it literally says if I don't follow these directions, I am violating federal law, because this is an EPA registered process. So then the other thing I want to mention is please make sure that all your chemicals are properly labeled. You cannot use a Sharpie and write glass cleaner or disinfectant on it. That doesn't work. Okay, go ahead. And then you also want to refer to EPA's pathogen list and approved disinfectants. You can actually go onto the EPA site, place the EPA number from the chemical that you have in your presence, or if you're looking to purchase chemicals, please make sure that they are listed on this. For example, I don't even talk to my customers about a disinfectant that would not be on that list. Arm yourself with the right tools, product, and follow-up. Follow-up is key. As Teke had mentioned before, you want to apply universal precaution theory, which in essence, you're making sure that every time you're cleaning a surface, that you're pretending the worst possible thing could be on there. For example, MRSA, I often get in front of folks and I say, how long can MRSA live on a surface? And they start to take guesses, and I keep saying, keep going, keep going. It can live on a surface 3 to 5 months. Okay, so before COVID, we did have things that we needed to worry about, and this is why we need to apply these cleaning processes. Proper mask wearing. So I think I got a laugh out of Monica the last time I talked about this. I kid you not, I was at a Home Depot. The gentleman took his mask off to cough. Then I was at Ollie's, and the lady removed her mask to sneeze. That's not how it works. The whole reason I'm wearing a mask to protect you, you're wearing a mask to protect me. The viral pathogen is so small, in theory, it can penetrate a regular surgical mask, but what it's doing is it's impeding that distance that it's going to travel. Go ahead. So consider placement of items relating to best practices. For example, trash cans in your bathroom. You want to place the trash can as close to the door as possible because you want to encourage people to use a paper towel to turn off the faucet and then open the door. It makes no sense to wash your hands for that 20 seconds and then go ahead and recontaminate them. So we don't want to have to Michael Jordan, across the bathroom. We want to make sure that receptacle's there. And lastly, and we've mentioned this, I think 3 or 4 times, you need to be as flexible as possible in your thought processes. I say that we're living in a state of MacGyverism. You want to adapt to using non-traditional methods such as charging bucket systems, and you're also going to have longer wait times because these items are in high demand. Go ahead. So there, I'm going to date myself there. There we go. There's MacGyver. And then this is just an example of a charging wipe system. Everybody wants, I want Clorox wipes, I want Lysol wipes, but those items are being allocated to us, and therefore we have to allocate them healthcare down. So another alternative would be to use a charging system where you would add the chemical, put the lid back on, and then you're ready to rock and roll. Again, making sure that that distributor, or for example, myself, would provide you with the proper label to put on the outside of it. Thank you guys for your time and attention today. We really appreciate you joining our call. I believe next we're gonna do the question. Oh, real quick, I just want to touch base on this. I was at Tread House, Teke, by the way, and I saw your Kicking COVID Together assessment. They had it proudly displayed. Also, they had my certificate displayed, and perception is reality. So this is another thing that we provide, is this additional support and training. You want your customers to walk in and see things like that. And the top one's kind of that's my CMI certification that I received, and jokingly, I transposed the cheerleaders and made them Americhem cheerleaders. So sprinkle humor in there too every once in a while. That keeps, you got to keep it light.
All right. Well, thank you.
You're welcome.
You guys did a great job wetting our thought processes here. I have, first of all, thank you for your overviews. There's some questions I think that we want to just throw at you a little bit to kind of get things started. Certainly then have the team that's here with us today to ask the questions that they have specifically. The question I had, I just wanted to throw a couple toward you that are related to small businesses. First of all, like Teke, I guess my question for you would be, you know, with this lag time in testing, how do you think that's affecting the overall counts, so to speak, and their accuracy?
Count and accuracy, it's probably not affecting a whole lot. You know, the lag is a problem because of the, you know, the quarantine status. You're going to want, employers going to want to put their employees onto a precautionary quarantine until they get confirmation whether or not it's there. I think we're currently at about a 2 to 3 day lag, which is pretty good.
Yeah.
I know out east and outside the area, it's up to 2 weeks. 10
Yeah.
days to 2 weeks. So so far we're doing pretty well, and hopefully we can maintain that. We do expect that the testing rate is going to continue to get better, but the issue is really just the precautionary and the effect unnecessarily affecting the economy.
If an employer has like a really specific question, is there somewhere they can go, like within your system at Penn Med, for a question to be answered? Or where would you advise them to go for a question that might be very specific to their situation?
Yeah, it kind of depends on the situation. So, and I'll just broadly stated, in the PowerPoint has the email address for Penn and HealthWorks, and you can certainly hit that. And by doing that, you're going to hit our occupational medicine team, our infection control team. You're going to hit the employee wellness and health coaches teams. So any of those, you can certainly hit us. Ours is going to be primarily around the process and the management of it. The rest, you know, Monica and Laurie and or those guys and Carl are going to focus on a very specific kind of content expertise. So if you have expertise related to what they presented, I would absolutely kick over to those guys. If it's related to the process of healthcare management in our communities, certainly see us. All of our primary care providers are actively doing their own management. When we first started, we had this community lab testing tents where we dedicated a certain team for the entire county. We've now decentralized that. So all of our individual family doctors have teams to manage it. On top of it, we have created our own contact tracing service for Lancaster County. And so that team is available as well. But any of our primary care services, even coming directly to HealthWorks, can get you the right answers.
Thanks.
Denise,
Yeah,
can I just interject a question from one of the participants?
sure.
And this is to Laurie. Laurie, can you just walk through the charging wipes one more time so that they
Sure.
can understand what to do? Thank you.
Sure. It's basically a bucket with a dry wipe, but this particular wipe is made to withstand chemicals. It's, you know, there's not every type of element you could add a chemical to and it would withstand it. So you would take the lid off, you pour the chemical into it, and again, it needs to be clot-based. We found that out recently too. And so it'll charge up, you put the lid back on, and then you can pull the wipe out and you're ready to rock and roll. It typically comes, depending on which one, it will come with a bucket with one wipe refill in it, and then the orders or the subsequent refills come 6 to a roll. We've been carrying 2 different types of them and kind of teetering back and forth, and we just got a shipment in, but what we're finding is that things before they even land are already sold. So what I encourage people to do is jump on board, create an order, and then get into what I call the queue, so to speak, so that you can ensure that you're going to get those items. So good question. Thanks for asking.
Can I ask one more, Denise?
Sure.
So another question that's come in, and I'm going to direct this one to Carl. Carl, are HEPA filters effective against COVID-19?
They are effective against catching the droplets and so forth. The problem with using like the HEPA filter, like an HVAC system, isn't designed to overcome. HEPA filters are very restrictive. So if you were trying to move the air through a HEPA on a normal HVAC system, like there would be no way to get the air through, like the system would end up causing damage. It would freeze up. It wouldn't cool properly. They do make like an external HEPA, it's called the General Air 500. The problem with that, it only brings 30% of the air will run through that HEPA. Like most pharmaceutical places and so forth we do with HEPAs, it's almost a separate entity than the unit itself. So like the air, it has its own fan to push through. But it is 99.9%. It catches almost anything that moves through it and it'll even remove smoke from the system. It's just having that system designed for that HEPA, like the cost would be huge to put it on like a standard system, and that would be your filtering system, because you'd have to do so many to overcome like that pressure that builds up in the system, if that makes sense.
Mm-hmm. Is there some value to purchasing, like say these scrubbers or HEPA filters, the standalone systems? I understand it's like 30% of the air would go through it, but would there be value for employers to consider?
There's such a small amount, like for the ones that stand alone, like
Mhm.
if you look at the square footage, I think a lot of them are rated for like 200 to 250 square feet. So it's really not doing like a huge space. The air scrubbers are very good to use for a system. If it's like a residential type system in a commercial building, like that's like, there's no air scrubber really designed for like a commercial, like for a rooftop unit that would be in most office buildings. It was more designed for like that unit, like you would have at home, even though it's in a building. The general air filter, HEPA filter, is kind of like, that's the one that pulls 30% of the air through it and then goes back into the ductwork. So you are picking up and you're reducing. Like everything right now in our trade is kind of like, you want to reduce the chances of having it. There's no, set, this is what you can do and this is going to keep everybody safe. It's more of like just a reduction. And there's so many more gains than just trying to fight off the COVID-19. Like it's, and that's where air quality's gotten lost. Just the common cold and all that stuff getting filtered out. You're going to keep your workers safe more than they were in the past, when filtering wasn't really thought of. And do I have to change them every 4 months? Can I make it a year? So you're getting a lot more gains than you did. People who have allergies, like filtering can just pretty much almost, knock allergies out of you, especially in your home or even in your business, just having that right filtering system and the UV lights. So there's so many more benefits to the air quality than just that, if that makes sense. It's amazing. Like my own home, like I have the general air for my kids' rooms, the HEPA. So, and then we have a UV light, and we also have like a media filter, which is a MERV 13. And my wife has really bad allergies, and it's pretty amazing. At night, she'll come in the house, and by morning, they kind of almost clear up. And our house is not, we have 3 kids, so it's not clean in no means, but it's funny how it's not dusty. Like, and I run the fan all the time, and knock on wood, my kids are very, healthy. I think last year, both my kids, before the COVID, 2 of my kids were making it through with no sick days, and the other one had 1. So I'm a big believer in the air quality. I know that was more about a home than a business, but you can do a lot of those things for a business to keep people safe. Like I know in our office building, we put the UV lights, and it's amazing. You can watch from the year before to this year, like the call offs. And I know that varies too with, how much, if the cold is, the common cold's more out there than not, but I do believe in those systems, and I probably didn't before I had them in my own home. So
Are there ways to test air quality similar to what Laurie had demonstrated? Are there ways to go into a business and test air quality?
you can check like particulate counts, you can check CO2. The CO2 is going to tell you the fresh air and how much you have. And you'll also be able to tell how much fresh air you're coming in. Like we can see like an actual rating to make sure that you are within the guidelines. And that's a big thing with businesses. A lot of businesses, you know, humidity is usually a complaint that we get, because especially now, you know, a lot of places are only running probably 50%. 50% of the workers are home, 50% are working. So they don't have like that heat load. So the air conditioning isn't running as much. And we'll get a lot of calls now for humidity just because of the reduction in body heat and people moving, and maybe the computer was, you know, it's not in their office anymore. It can really just affect everything, but that's something that we can check with air quality testing. So there's a lot of different things as far as checking, like, you know, is there contaminants in the air? There's nothing like that, but you can test it for molds and bacterias, Legionellas, a lot of different things that are out there that are still a danger.
Right.
I have a quick question, Carl. Do you guys do the testing? Or
We can do probably about 50% of that testing.
okay.
A lot of that stuff there, we would actually sub out to, like, there's companies that's their primary
Yeah.
focus, the ones who certify clean rooms.
Yeah. We work with ACIA out of York. I don't know. If
Okay.
Yep.
So
You know those
yeah,
guys?
we deal with them. We deal with EnergyWorks they're out of Harrisburg. So, but they come in and they can tell you exactly how many turns. They can test your filtering for how tight they are, as far as, is it making a good seal when the filter's in, or is some of the air even getting around the filter? It's pretty amazing the things they can check. But yeah.
Are there certain businesses, just one more question for you, Carl, that should be making special attention toward their air quality, do you believe?
Anything with office buildings, like it's so important. Office buildings, restaurants, like as an HVAC person, you know, you go into like a restaurant and I'll tell my wife, like, man, the air conditioning in here is terrible. And she'll look at me like I'm crazy. But I think people now that all this has come about, they want to be safe. And I know, like, you know, going to a restaurant now is kind of like, do you go out? Do you stay home? They're saying it's safe to go, you know, not safe, but taking precautions. But, you know, there's still a big risk. And you go into a restaurant, and a restaurant is one that's supposed to have the most fresh air of almost anything. So, you know, you're 25 CFMs per person, which is just an astronomical amount. And I can guarantee you 90% of the places you go to eat probably don't have that. And I think it's bringing it to the forefront, but I think more in an office building situation. A lot of times warehouses have makeup units that just constantly are bringing in fresh air. Their heating systems are basically 100% outside air. So warehouse situations, you're fairly safe. Gyms and restaurants and office buildings, you know, they were always, like, I don't want to say restaurants and gyms didn't put priority to maintenance and stuff, but they're always the ones that you kind of, as a technician, like to go to, because you're like, wow, look how dirty that was. Like, it was always kind of neat to see the results of what you did cleaning wise.
Right.
That makes sense.
Carl, I just got into the world of ice machines, and wow. Wow.
Nasty. And soda
Oh,
machine.
wow.
You probably wouldn't drink
Unbelievable.
fountain soda.
Yeah, I'll
Yeah.
be like, I'll bring my own ice. I'm good, thanks.
Yeah.
It's really bad. It's
And
really
that's a
bad.
place, you
It
know,
was
like
very
the ice,
enlightening. Yep.
the ice machines every 4 months, they're supposed to be serviced. And, you know, we just got a call the other day from a commercial place we have that's like, oh, we didn't even know you had to get that checked. And it was bad, like for 2 years. And
Oh my God.
it's bad.
Yeah, I was
Just-
horrified. I
Thanks
went to
for
a
these
golf.
wonderful insights.
Yeah. So we actually,
Humor.
we have just so you know, we have a system that we installed. I did a trial at a restaurant. They were cleaning it every couple weeks because, of course, Pennsylvania has hard water, and that built up as well. And we did 2 checks on it, and they're blown away. I mean, pristine. It's so clean in there, because what it does is, and I know we've talked about ozone before as being hazardous, which is a very small amount, but it infuses into the system. So as it's rolling through the system, it's actually killing the bacteria that causes Legionella, for example. And I'm sold myself. I want to hook one up to our fridge in the kitchen now. It's just amazing.
The reverse osmosis systems and so forth.
Oh yes, reverse osmosis. We use that in sterile processing as well. Yeah.
They're very, you know, we were just in Ocean City and you talk about like ice and things. And I looked over, my son's sitting there like reaching in the cooler and like put a thing. I'm like, no,
Yeah.
stop eating my ice cube. What are you doing? And then like after the cooler like started melting down, it's
Yeah.
like, I pull him over. I'm like, do you see how cloudy that water is? Like,
Oh yeah.
so,
If you're ever getting a soda and it fizzes a lot at the top, probably not drink that either.
yeah.
You should. Everybody should go out to dinner with me, Carl, and Monica, and Teke. Can you imagine? You guys would never want to eat out again, but
We would never be able to find a restaurant.
like, nope, next one.
Are there some questions from the folks who've attended? I know I have some additional questions for the panel, but I wanted to open it up for others to ask questions if they like. We could open up the mics even, Kathy, if you'd like. In the meantime, Monica, I had a question for you. Like, I know a lot of the hazard assessments and remedies with OSHA are to be considered reasonable. What do they mean by reasonable? You know, what's reasonableness?
That's a tricky question. They want to see that you've done your due diligence. So there are a ton of checklists that you can use on OSHA's website, on CDC's website. They want to see that you're really going through that. And I would say documentation is going to be your best friend through all of this when you talk about reasonable, to show that you have gone through those checklists, say the date on them, who went through them. That's going to be your proof that you went through all the different little niches that are in your business, to show what is and is not a hazard out there.
Thanks. Okay. I don't know if there's questions from the team. Jen, do you have a question or look like?
Not necessarily a question, but there's a lot of talk from the federal government and state governments about relieving businesses of liability related to COVID-19 cases brought by their employees. If they would put that protection in place, do you think that that's going to encourage a business to be less attentive in their procedures because they know that they won't risk the risk of a lawsuit? Or do you think it's not going to make any difference at all? I don't know who to direct that to.
I'm not an HR legal expert, so I don't know. That would surprise me, honestly. But I don't know. Sorry, I'm not an HR legal expert there. Probably a good topic to have later on, maybe.
Yeah.
To that point, I do want to point out one of the acts out there. It's called the Whistleblower Act. That's out there for businesses that we do need to pay special attention to, especially with COVID-19. If an employee does bring up any health or safety concerns at work, the employer cannot punish them in any way. They can't reduce their hours. They can't lay them off, anything else like that. If there is any retaliation whatsoever, that employee does have legal standing to come back to the business and sue. And Pennsylvania is very active in this. You can see several cases of hairdressers dealing with hazardous chemicals recently within the last year or so, where there has been cash settlement awards to the employees who have brought up hazards. And COVID-19 is a recognized hazard. So if an employee does bring up safety concerns, it's not, a restaurant can't say, well, screw you if you don't want to work here, just leave. We'll find somebody else who's willing to do it. You need to make sure that those are addressed within reasonable grounds.
I had a question specifically around HEPA standalone, if it's good for a single room, Carl, like for a home office today. Like a lot of us are working from home, but I guess she's thinking again that square footage question.
Right.
Is there like some guidelines for square footage and the use of these scrubbers or HEPA filter standalone products?
A lot of times when you buy the standalones, it'll tell you like the square footage, the max. So you'd have to figure out your room space. Any kind of filtering system like that's not going to hurt. the big thing with a home that you notice if you're not getting the proper, if your room is carpeted and you get dirt under the door, or like you're getting staining under the door, a lot of times people don't know, like that's just the air pushing out of the room. So that tells you that you don't quite have enough return in the room. So when that door is closed, it's in fact making that room kind of like a paper bag or a plastic bag, and you're blowing into it. So the air is looking for anywhere it can go to get out. Ranch houses are always for that because they'll only have like 1 or 2 returns. Like my own house only has 2-3 returns. And when my kids' rooms or our bedrooms shut, like we have hardwood, it's amazing to feel that air just come under the door. So if like our house was, if it was carpeted, you would see a lot of the dirt and so forth just from, you know, just normal dust and that buildup. Like the standalones are a good thing. If you're gonna, you know, in your home, make sure you're running your fan all the time just to keep that air circulating, because it's kind of doing the same thing as the standalone. You're constantly pulling air back to the HVAC equipment and pushing air out. Duct cleaning, making sure that, you know, that you have your ducts checked and make sure they're clean. Even a brand new house, you probably wouldn't want to see the inside of your duct. When I worked for a carrier dealer, that was always one of the things. Like we had a new construction division. So if you would go on a Saturday, it's kind of amazing the things that guys would put down those grills and those vents. So it's never bad to have it checked and make sure it's clean.
Okay.
Probably every 5 years.
All right, thank you. There was also a question I received for Laurie. One thing that was mentioned was that there seems to be some value, like as even I guess it's across the team here, that when you're going over the basics of cleaning and disinfection, that they find that they may have been spending more money than they probably should have in the first place. Like if they would have, like they could streamline their cleaning efforts and actually have a higher quality outcome and actually a least expensive outcome. And I think if they, like in other words, if they would have done things the right way in the first place kind of thing. I'm sure this is across the board for all of you. You might be able to comment, but this question was actually asked specifically for cleaning and disinfection. Could you comment on that piece?
Sure, absolutely. My goal, our goal at Americhem is not to sell every product under the sun. We really want to streamline for our customers because, as Monica made mention to, less chemistry is better. It really is. You don't want your folks mixing chemicals whatsoever. It's never a good thing. So the other important part of that is, as far as cost effectiveness, would be to install like a dilution system like we did at the Tread House. Very simple, it connects to your water line and there's a dial on it. So if you want this product, you turn to that and specific to the area that you're cleaning. And again, we partner with you so that you know exactly what product goes where and how to use it, versus you bringing in a bunch of products and just kind of, you know, guessing. We have a lot of people that say, you know, like the Gatorade, here's orange, you know, and they'd be like, well, this product's not orange enough, or I gotta add more of this, or it's not, you know, I'm gonna stretch it out, so I'm gonna add more water to it, right? So I can get more bang for my buck. But what you do is you're actually ruining the initial integrity of that chemistry. The reason these chemists spend hours and hours in a lab trying to figure out what kills what and how long it would have to lay on the surface, it's very scientific. And I feel like a lot of people, and until I entered the cleaning world, I had no idea how specific it was. I had some idea from my sterile processing days, but yeah, that's why it's great to partner with somebody like myself. I say Amazon, they can deliver boxes to your door, but they're not going to hand deliver a product when it's, you know, when you need it right away. So good question. Yep.
All right. Well, I don't know if there's any parting words that any of the experts would have wanted to say. Certainly, we're going to poll our participants around getting some feedback from them about the session.